All right, so welcome everybody. This is an information session for the Population Health and Place PhD program that we run here at the University of Southern California. And you can see from this slide that it's a collaborative enterprise. It involves faculty from the Department of Sociology, which is in Dornsife College of Letters, Arts and Sciences, the Department of Population and Public Health Sciences, which is part of the Keck School of Medicine of USC, and the Spatial Sciences Institute. For the purposes of this degree, it's the Spatial Sciences Institute that is the administrator, and so that's a key thing to understand, because otherwise things could fall between the cracks. And as I'll show when I introduce my two accomplices here momentarily, there are many more schools involved as well. Next slide, Jesse, please. So there'll be three presenters today. There are then three academic units that are represented today, but you'll see before the end of this presentation that there's 5 or 6 or 7 involved on a regular basis. The Ph.D. degree has a curriculum that's evolving and changing and modernising. There's a huge wealth, breadth and depth of research opportunities that we'll speak about. My three colleagues, I'm actually not going to talk about my own work, but somebody else's work here. And then we'll introduce some current PhD candidates and students, some graduates, and then at the end we'll take questions. Next, Jesse. So the first one here is me, of course. I'm John Wilson. I'm occasionally a professor of spatial sciences. Other moments I'm a professor of sociology. Other moments, including this morning, I'm a professor of architecture. Occasionally I'm a professor of population and public health sciences. More often than I'm a professor of computer science. And I'm occasionally a professor of civil environmental engineering. And I work collaboratively. I've been at USC for 27 years, so I've built a lot of relationships. But most of my work, no matter who I'm collaborating with, is built around GIS and geodesign, spatial analysis, environmental modelling, and public health. And I'm interested in how the world came to be like it is today, but I'm even more interested in what could the world become if we had smart people running the world in the future. Second person here that's on screen, I think, Jennifer Unger, is much more accomplished than I am. She's a very distinguished and brilliant professor in population and public health sciences. And her work is about health disparities, psychosocial and cultural predictors of adolescent health risk and health protective behaviours. And she will speak in a few minutes about her research and how it overlaps with population health and place. And beside me, I have another outstanding colleague, again, probably better than me, is Associate Professor of Social Work and Spatial Sciences, Daniel Heckman. And his work is built around child and adolescent development, neighbourhoods, socioeconomic disparities in health and marital health, I think, and neurosciences, stress and adversity. And so these are two very fine colleagues, and they have in various ways brought lots of value to what essentially is an interdisciplinary degree in population health and place. So next I'm going to talk briefly about the 3 departments in which you'll see momentarily provide the coursework that is at the front end of this particular PhD program. So Jesse, next. So I told you that spatial science is in fact the creator of this program and the administrative lead of this program. But I have the 3 departments that provide the coursework, or most of the coursework, in the order population, health and place. And so as the sociology, we look for the population classes. This is a long-standing department. It was founded in 1915. that specialises, or it has a good track record around culture, demography, families, gender, immigration, labour, race, ethnicity and religion. It's in Dornsife at least, a relatively big department. I think it probably has 20 or 25 faculty. But the population piece is sociology plus, because you can find other elements of the population sciences in the USC Suzanne Dwork Peck School of Social Work. It was founded in 1920 that Daniel was part of. You can find more people in the USC Leonard Davis School of Gerontology that was founded in 1975 and is the world's first, largest and most renowned educational institution on aging. As I've got older, I've become more interested in what they do. And then there's the USC Department of Population and Public Health Sciences, which was founded in 1977. It's gone through several name iterations. It's among the 10 top schools of public health and NIH funding, and it's a big department that's divided into 6 divisions that I'll talk about in a moment, right? And so these are not boundaries, but these are concentrations, and these different fields, population, health, and place, are going to flow over each other in all of these units that I'm talking about. So the second is the Department of Population and Public Health Sciences. As I said, it was founded in 1978. It was first called the Department of Family and Preventive Medicine. It then changed its name to the Department of Preventive Medicine, and it became the Department of Population and Public Health Sciences in 2021. There's more than 100 faculty, and they're divided into 6 divisions: bioinformatics, biostatistics, disease prevention, policy and global health, environmental health, epidemiology and genetics, and health behaviour research. And again, my experience, because I spent a lot of time there, is that these divisions are not, black and white either, and there are many fine scholars in population and public health sciences that work across those domains, not just in one of those domains. The other thing to say here is they have a very large research and teaching enterprise. They rank number 2 in population health research funding from the National Institutes of Health. And I don't know whether it's good or bad, but you need to travel to visit them because they are housed in the Soto Street building, which is next to the Health Sciences campus on the east side of downtown. And then last, the USC Spatial Sciences Institute. It was founded in 2010. I am, in fact, the founding director. In 2009, it was just an idea in my head. And so I'm tremendously proud of my colleagues and everybody else that has contributed to who we've become today. Today, we're 11 full-time faculty. We have 44 faculty affiliates. We're in the Alan Hancock Foundation building, where we have faculty and staff offices and some novel and state-of-the-art teaching spaces. We're in the centre of campus. That was the big deal because we're currently sitting in a half basement. We can see the sky, but at ground level we're underground. We have a full suite of academic programs. We have a substantial research enterprise, and importantly, we have a large computing infrastructure that we support. And we are the place piece. But by no means are we the only piece there. Many of my colleagues in all of the departments I've spoke to are also interested in place. And in the Price School of Public Policy, we have many scholars who would complement what we do here in spatial sciences. So next. Okay, so the curriculum. The Ph.D. program starts with a class called SSCI 600, the Geography of Life and Death. 2 really big topics. So far, I've taught that class. It's probably the most ambitious thing I've ever tried to do in my life. Seems to be okay. Nobody tries to kill me afterwards, so that's probably good. And then there's a stream of classes that are in what was once preventive medicine, but is now population and public health sciences. So there's a class about biostatistics, there's a class about epidemiology, and there's a class about environmental health using an epidemiological approach. On the demographic side, there's a class about demographic methods and a class about social demography, and typically they're taught in the Department of Sociology. And then in the spatial science strand here, in addition to 600, there's a 680 class spatial computing, there's a 683 class principles of spatial data analysis, and then there's a 684 class spatial modeling with GIS. And then at the top there, you'll see two more rows. One row says SSCI 681, Advanced Quantitative Methods in Population Health and Place. That's a general kind of social science quantitative methods class. It originally started in sociology. For various reasons, it was moved to spatial sciences. And then, as I'll talk about in a second, we also in the first two summers run two classes, 601A and 601B, and Bob Voss, who's sitting here, the Director of Graduate Studies, teaches those two classes. One's about prepping you to write a review article or an empirical paper with the idea that you might use that as a first attempt maybe to try and publish something. And one of our students from the cohort that started a year ago just did this past summer and just had a paper accepted last Friday. And the second class, B, is the opportunity over a summer for you to write a complete first draft of a PhD dissertation proposal. Because after you defend your dissertation proposal and you pass your qualifying exam, then you become a PhD candidate. And at that point, then the focus is on SSCI 794A, B, C, D, and Z, which is you working on your doctoral dissertation. It's always amazed me, and probably I was the same when I was a PhD student, but when you are a PhD student, you describe this as the most stressful time in your life. But if you've lived as long as I have, you will remember fondly that that was the only time in your life that you could tell everybody else to bugger off, and you had this important dissertation to write, and you had nothing else to do, right? If you told me I could do another PhD and you would fund me, I would be in heaven compared to the job that I have today. So then let me speak broadly about some protocols here, because we did not set out to be just another PhD program. We had a particular set of goals in mind. And the most immediate goal is that when you look across all the different fields, there are many fine PhDs in what I might call today the spatial sciences. In some institutions, they might still be a PhD in geography, or they might be a PhD in geospatial science or spatial planning or something like that, but essentially they are variants of the same thing. You can find many fine PhDs about demography or the population sciences spread across the country that typically emanate in many different departments, just like the spatial kind of PhD would too. And there are many places where we have a PhD in epidemiology, a PhD in environmental health, a PhD in behaviour, etc., right? We did not want to copy any of those. We identified that there was a big gap in terms of people that could talk and walk across different fields, knowing that there are opportunities and important problems and challenges to solve at the intersection of population, health and place, right? There's a couple of yard marks that are good examples for that. In the United States of America, a few years ago, a young woman that was my postdoc, who did a PhD in epidemiology in the Keck School of Medicine, left my postdoc early so that she could work for the CDC, because they were putting together for the first time a data set that described life expectancy at birth by census tract. A census tract normally covers about 7,000 people. There are thousands of census tracts that make up the United States of America. And lo and behold, there was a census tract in Mississippi where if you were born there, we know nothing else about where the person lived or what they did in life, but life expectancy at birth was it was somewhere in the middle 40s. Moved from there to the state of Washington, and somewhere on the outskirts of Seattle, there's a census tract where if you were lucky enough to be born there, the life expectancy at birth, based on mortality records, is in the mid-90s. So here we have the opportunity in one country for somebody to have twice the life that other citizens did. Now, the really sad thing is that we could point to parts of the world where 44 or 45 would be a major improvement in terms of life expectancy. And in my mind, this is talent that goes to waste. Because I don't know about you, but I don't think I did very much that was productive before I was 20-something years old. And so a lot of people, including my parents and teachers and so forth, made lots of investments for me to become who I am today. And if I die relatively young, then that takes away the return on investment, right? People are human capital, and we need to think of them as such. And so that's one marker. The other marker is that things like health are complicated. I have a sister that's a chain smoker. In New Zealand, a cigarette box, if you go to the store and buy 20 cigarettes, the back side of the box says this product will kill you. I'm thinking, well, that's a pretty important message. I think I won't buy one of those. In fact, I never actually had a single cigarette. And yet I have a sister that grew up in the same household, and apparently she either can't read or she doesn't turn the box around to see that side. And, she's going to smoke a box a day. But the important thing there is maybe not what she chooses to do in her life, but as we all know, secondhand smoke is almost as bad as smoking a cigarette yourself. And so there's just a lot of things that have to be brought together to change the world for the better, and involves that intersection. So the admissions criteria might not be popular, but I'll state it in a very simple way. When we have a committee, admissions committee, there is typically somebody from population, somebody from health, and somebody from place. And the marching orders they get from me, the director, is that we're looking for racehorses. We're trying to avoid snails. Right? We want the opportunity to work with the best human beings we can find that want to work with us, and we want to help them become the best version of themselves they can, with the idea that they can go out and change the world. Much as I like snails, there's not much I can do to make them faster. And so there's maybe some better thing for them to do than a PhD in population health and place. The funding. Under the current rules that we're using here in spatial sciences, because we're the administrative unit, we are obligated to give students that we want to make offers to a 5-year offer. That 5-year offer includes 2 years of fellowship. They are typically taken as the first and the 5th year. And then the other 3 years, you could either be a graduate research assistant, or you could be a graduate teaching assistant, or you could have a competitive fellowship that you had won, right? In addition to that, when we make the offers, we include funding for the first 2 summers. And the purpose of that is for the first summer that you can focus on 601A, which is the empirical paper or the review article. And in the second summer, you focus on your research dissertation proposal. We want you to get to the dissertation in the best time and the best shape possible. And that means we have to look after you and we need to provide a set of lanes that enable you to get there and hopefully start serious work on your dissertation in that second summer. Because if you write a good proposal, there will be a good part of the literature review and background and stuff that you've already prepared for what ultimately becomes your dissertation. It's an interdisciplinary degree, and so we have some protocols, some guardrails to help us stay in that lane. And the first is that we expect students to have 2 co-advisors from 2 of the 3 tracks. So you'll see a long list of faculty shortly. There's a population track for faculty, there's a place track for faculty, and there's a health track for faculty. Some faculty might qualify for multiple tracks, but we don't let them do that. They have to designate a primary track, and that's so that we can ensure there's 2 co-advisor role from 2 of the 3 tracks. And your initial committee that you defend your proposal with needs at least 1 person from each of the 3 tracks, right? And we'll talk about career trajectories when I show you what our graduates are doing a bit later. Now, graduate teaching assistant or graduate research assistant. So I'm the administrator of the program, let's say that's true. And at Spatial Sciences, we have lots of classes that require graduate teaching assistants. My biggest problem is I never have enough TAs. And the reason I never have enough TAs is because many of my colleagues are anxious to enlist and use the students in the Population Health and Place PhD program as graduate research assistants. I think Daniel among them. And many times this is a win-win. It's a win-win for the faculty member that steps up to do this, and it's a win-win, of course, for the student who will meet new people, learn some new skills probably, and maybe work on some additional publications. And the reason we can do that, if we go to the next slide, is that, and this is a sample, I realise I haven't got all the schools here, but in Dornsife College, the Centre for Social and Economic Research does a lot of work these days around health, and particularly around population health and place. They have a big internet survey they run on a continuous basis with a very large grant from the National Institutes of Health, for example, that some of our students have used. In the Keck School of Medicine and Department of Population and Public Health Sciences, we have a lot of very large and nimble NIH-funded centres. And this is before we get to places like the Norris Cancer Centre and the Surveillance Survey and so forth. In gerontology, we have a Centre for Global Ageing, a Centre for Lifespan Health, which of course speaks to the life course. Children's Hospital in Los Angeles, where there's the Southern California Centre for Chronic Disease Prevention and Treatment. And nowadays we're a full participant in something called the US Coordinating Network for Exomics in Columbia University. And that's just a sample. For example, I didn't speak here about the School of Social Work, which is important as well. Next, Jesse, please. Okay, now we can probably share the slide deck later with each of you that are here today. But what I want to say is that we have a very broad and a very deep bench of faculty that you could choose to work with. And so on this list, we have people that span probably these 3 fields, population, health and place. Next, please, Jesse. And here's another big long list. They're not all from necessarily the same departments and institutes we've been talking about. Juan de Lara, for example, comes from the Department of, what's it called, Bob?
American Studies
and Ethnicity, in Dornsife College, for example. Next, please. Again, Daniel's here on this list, but there are many other fine people as well. Next. More again, and next. More again, next. And then next. Can't believe there's so many. I think there's 47 total. I said 44 before, but I think I counted this list when I looked at the slides on Sunday. And so one advantage of an interdisciplinary program is that there are lots of faculty that you can lean on. There's lots of faculty that you can engage. Sometimes you might work with them extensively for multiple years because they're your co-advisor, but sometimes there'll just be that aha moment where you said, I'm thinking of doing X, and they said, have you ever thought about doing Y? And you go home and you sleep on it and you come back the next morning Well, that was super helpful. I'm now doing Y, right? That was certainly true of my PhD. Okay, so what we want to do in the next little bit is to go a wee bit deeper, and so well, we've already done that. So Jennifer, we're going to ask you to go first, and then Daniel, and then I'm just going to wrap up by saying something about the work of Jennifer Elshire, just because it'll encapsulate what I think might be the sweet spot that we're talking about here. So Daniel, you want to turn? Jennifer, sorry.
Okay, thank you, John. So hi everyone, I'm Jennifer Unger. I'm a professor of population and public health sciences. I've been here at USC for a long time, since the 90s. I actually did my PhD in population and public health sciences, which when it was preventive medicine. So my main area of focus is adolescent health risk behaviors, especially cultural influences on substance use and tobacco control, and all the things that you don't see on the screen right now. But today, I thought I would focus on a study that's very much in the spirit of population health and place. So I'm going to talk about the physical and mental health effects of the Los Angeles wildfires. For those of you who are from LA, you probably remember in January, we had horrific fires that destroyed big parts of Altadena and the Palisades. Those areas are still recovering and will probably be recovering for years to come. It was really a tragedy. Where we come into this is we had happened to have done a study of USC faculty, staff, and students during COVID, which was another thing that wasn't my main focus, but I was working with a group of faculty who wanted to look at the predictors of getting COVID and getting vaccinated and wearing masks and all kinds of things like that. So me being like the population health person, I helped with designing the survey, and we ended up giving that survey to USC faculty, staff, and students, and did that like in 2021 to 2023. So and at that time we were just thinking, oh, this is a COVID study, we'll follow people for a few waves and publish some papers about COVID. But then the fires happened, and we realized that we have this sample that we could also ask about the fires. So we leveraged this cohort that we already had because we had pretest data before the fires, and then we got in contact with them again to survey them after the fires. And this map here shows that I think it was done by someone in your program. This map shows in red the locations of the fires, and in green the locations of our participants for the COVID study. So there was a lot of overlap, and we were able to email them and have them fill out more surveys about the fires. And what we're looking at is what are the effects of the fires on physical and mental health? And so far, we're still in the middle of this study because this all happened this year. But we compared people who evacuated and people who didn't evacuate. And most of the people who evacuated, their houses weren't destroyed. They were told to evacuate, so they evacuated for a few days and came back. But those who evacuated were 73% more likely to be depressed months later, and 2.53 times more likely to have PTSD compared to the people who didn't evacuate, even after controlling for differences in their mental health and demographics before the fire. So this was a nice example of how we're able to use data that we had and look at people's pre-fire mental health, and then survey them again and bring in the GIS stuff, bring in the demographics. I mean, the geography and the demographics to show the effects of the fires on short-term mental health. And we're doing more. We're in the middle of this right now. We're taking hair samples, dust wipes from people's homes, and we have these silicone wristbands that can absorb volatile organic compounds. So we're giving those to the people who filled out our survey, having them collect some exposure data, and then we're going to use GIS to compare, like, how close to the fires they were, and also how close to the different smoke patterns they were, because we have colleagues who were tracking where the smoke went. And we can see how people's exposures and their mental health and their physical health differ by how close they were to the smoke and the fires. So that's just one example of a very interdisciplinary study that I've been involved with. And this is also an example of how we collaborate across divisions in PPHS, because I'm in health behavior research. I usually do survey studies of just individual health behaviors without really looking at the context that much. But I'm working with my colleague, Frank Gilliland, who's an environmental health person. He's the one who knew about all the exposures and the chemicals and where the smoke goes and stuff like that. So it's been a really nice collaboration. And another example of this is at the same time, sort of independently, we had been conducting surveys of kids in schools for a totally different reason. We're looking at tobacco product use. So as you all probably know, there are all kinds of different vaping devices and oral nicotine pouches, and now there's synthetic nicotine and there's nicotine analogs. There's all these different ways of getting nicotine that people can use, and they're very popular with kids. So we've been doing an ongoing study in our Tobacco Center of Regulatory Science to look at what predicts whether kids use these products, and what characteristics of the kids, like their mental health, their attitudes, their peer influences, and also the characteristics of the products, such as flavors and different other characteristics of the products that make kids more likely to use them. And it turned out that this school-based study was ongoing in schools around the LA area and had just collected a wave of data right before the fires. So my colleague Alyssa Harlow took the lead on a study to add some questions about the wildfire experiences to this survey, so that the next wave, when they went back to the kids, they asked them how the fires had changed their lives. So whether they're worried about family health, or feared for their safety, worried about their own health, feeling anxious, stressed, or depressed, more connected to community or neighbors, that's a good one, less physical activity, problem sleeping. So, and as you can see here, the kids, very few of these kids actually evacuated, and very few of them lost their homes, but they had a high prevalence of these psychological effects of the fires. And this is 3 months after the fire. So they're all pretty much back in their homes and back to their regular routines, but they still had these lingering effects. And we found that the more negative wildfire experiences they had, the higher the likelihood of depression and anxiety, even after controlling for the depression and anxiety that they had before the fires. So these are just two examples of the ways that we all collaborate, across divisions, across departments, across centers, and we can, bring together population health and health behavior with environmental health research, with GIS, with place. And these collaborations lead to a lot of really nice research that none of us could do individually, because none of us have all the expertise. But when we all work together and, pool our resources, then we can do really interesting stuff. So I've had the pleasure of working with several students in this program and really enjoyed it. And I hope you decide to apply and come. And that's all I have.
Thank you. Daniel.
Hi, everyone. I'm Daniel Hackman. I'm an associate professor of social work at the Suzanne Dorn Peck School of Social Work, and really excited to be here. I am very enthusiastic about the Population Health and Place program, and feel like I think as you heard that many of us, although we might have one primary area, are often a good fit because our work actually spans multiple areas, and that's where I feel my background is actually quite interdisciplinary. Actually did public health policy advocacy before graduate school. My graduate training was in clinical psychology, doing research with a cognitive neuroscience professor, and after that did a clinical internship and a postdoc in the Department of Psychiatry, and then was doing social determinants of health work in the Department of Population Health Sciences. And so I experienced the the richness that comes from taking that interdisciplinary perspective and the work that we do on a daily basis, and find that this program is incredible at kind of helping generate and launch really creative thinkers that contribute so much to the research world as well as the practice world as well, the research that comes out of this. I thought I'd start off and just give in addition to that preamble, just a little overview of how we in our team, how we think about the questions that we're addressing. We're really looking at child and adolescent development in ecological context. So how does that, in child development, we don't necessarily mean ecology like ecology and evolutionary biology. We just think about the multiple levels of environmental factors that children and adolescents are exposed to, from, we have a kind of typical way of showing that on the left, from the more proximal things like one's home environment, one's family or peer relationships, things that are really proximal, to social networks, to neighborhoods, to more macro level environmental characteristics, economic environments, and so forth. And really thinking about the role of these kind of different levels or spheres of influence on child and adolescent development. We take a life course perspective on that work, although most of what we do is focused on children and adolescents, or sometimes young adults. The focus is often on how, not necessarily whether they're just differences in health and well-being during childhood and adolescence, but how childhood and adolescence has become associated with the development of, whether there's kind of aspects of psychological development, cognitive development, biological and neurobiological development that can influence health many years, many decades downstream. So we're thinking about what are sometimes thought of as like transdiagnostic mechanisms, not just across different aspects of mental health, but also about things that might contribute to physical health and mental health. So thinking about those kind of early precursors. So we take a multi-level perspective. A lot of our work focuses on neighborhoods and the neighborhood environments that children grow up in. We're really interested in contextual protective factors in the psychology kind of world. A lot of times when we think about protective factors, oftentimes there's an interest in individual characteristics, which is really important, but for our interest, we're thinking more about those environments that children are in. Those oftentimes are maybe more directly policy relevant, so we're hoping the work can inform on that kind of approach. And we're really thinking about not only are children kind of nested in this sort of multi-level context, but also thinking about children and adolescents from a multi-level perspective, thinking from cells and epigenetics and epigenetic change to brain development to kind of behavioral development and health. So really thinking about kind of within an individual as well as outside the individual, multi-level perspective. You can go to the next slide. To give an example, so I just have two slides. One is of a project from a couple of years ago, and then I have a couple of examples of some projects where PhD students have been leading the work. This focus on neighborhood context and the broader context in terms of thinking about child and adolescent brain development is relatively new. There's been a move towards thinking about environments and stress and adversity, but much less thinking about that spatial context, that neighborhood context in development. And so a couple of years ago, we capitalized on a large nationwide sample. It's the largest study of neuroimaging study of children and adolescents in the country. It's a multi-site study. We didn't collect the data, but it comes from 21 sites, including one here at Children's Hospital, to ask whether children's neighborhood environments, separate from family socioeconomic status, their subjective perception of the neighborhoods, whether neighborhood disadvantage predicted different aspects of neurocognition as well as brain development in terms of brain structure. And we found a couple of examples here that higher neighborhood disadvantage was associated with lower performance on tasks, as well as lower cortical surface area and subcortical gray matter volume. And that's what's shown by the kind of blue lines. But one of the things I also want to highlight here is all of the variation of that data. So at a population level, we are explaining a potentially important level aspect of variance, but there's a lot of variability. There are a lot of protective factors. There's nothing that's deterministic. And so that's where we're also interested in what supports the ability for children and adolescents to thrive, even in the context of adversity. You can go ahead to the next slide. What I just want to highlight on the left is actually some work being led by a current PhD student that was presented at the SRCD, Society for Research and Child Development Conference, where what we've been interested in when we think about children in neighborhood context, we can focus on one thing like disadvantage or one thing like pollution exposure, but really children are experiencing a whole set of intercorrelated exposures and experiences in their environments. And so Jahal Wong, who's leading this work, has been focused on identifying kind of clusters of how these different characteristics at the neighborhood level, whether it's from environmental exposures to services and amenities in the environment, how these cluster into sort of types, neighborhood types that are kind of downstream from stratification factors and broader economic factors that kind of shape how these are distributed across the US, and then how that's associated with child and adolescent development. So I don't know if you can quite tell, but that's a map showing kind of the distribution of these neighborhood types across a number of different regions in the US. So that's kind of, kind of unpacking a bit more about neighborhoods. On the right is some work that was led by who's a prior PhD student. And this was work that was focused on environmental predictors of autism spectrum diagnoses. Over the course of time, in the past decades, there's been some mixed literature on whether socioeconomic status, on how it predicts autism spectrum diagnoses in countries that have universal health insurance, as well as there seemed to be a pattern that was fairly similar to other aspects of health and well-being in the US, where there's higher disadvantages related to higher rates of autism spectrum. But in the United States, for a long time, that actually was the opposite, it was reversed. And so one of the speculations have been that can be due to screening and access to care, that maybe what was being captured weren't differences in autism spectrum disorder, but in terms of diagnoses based on access. So Shin, you asked the question whether or not higher neighborhood disadvantage, when we were looking at this amazing resource of population based study, all of whom had access to health insurance, and so at least had greater access to screening, whether in that case higher neighborhood disadvantage was associated with higher or lower diagnoses, and which he found was that higher neighborhood disadvantage was associated with increased rates of ASD diagnosis. And that was just one of the papers that she led, where she was also looking at pollution, air pollution, as well as the intersection between neighborhood disadvantage and air pollution as predictors. So those are just kind of a few examples of the work, but really it's a program that really supports a lot of incredible innovative work and great collaboration to set the stage for really important contributions.
Thank you. So Jesse, next please. So just to reiterate the value of the intersection, this is some work by Jennifer Elshire and Choi. And this was assessing the role of ambient outdoor heat and epigenetic aging by leveraging data from a nationally representative sample of US older adults. So Jennifer is a key faculty member in the School of Gerontology, and Choi was a postdoc, and I think maybe got a PhD there as well. And so they are the experts in this case in thinking about this rich data set that's a cohort of older adults. And so their conceptual design is both simple and effective. So they decided to look at ambient outdoor heat measures across time windows. So the day of blood collection, because this was a cohort that people were tracing and taking regular measurements, lagged 7 days. So whatever the date was of the collection, what was the heat expression 7 days before that for that individual? And then 30 days lag, 60 days lag, 365 days lag, so that's a year, or a 6 year. And those estimates would be different for different people because they didn't all get blood taken the same day, multiple times, right? Next, please, Jesse. And the brilliant thing about the world today is data about many phenomena and their distribution across space is widely available. I mean, just in the last few weeks, Google has announced Alpha Earth, which claims to be downloading satellite imagery from providers constantly, and that they now have a satellite representation of the whole of the Earth's surface. Unbelievable. I can still remember when we sent somebody to the moon and they sent us pictures looking back. And I was thinking, wow, that is so cool. And so here's the total number of heat days during the period 2010 to 2016 across the contiguous USA. You can see that south and southeast and up the east coast and west coast and across the whole of the south coast, there's plenty of heat. Next. Jesse, next slide, please. You're stuck. Oh, I think we skipped two. There should be two more. Okay, so there we have. This is extreme caution level or higher, and so same period, but the cutoff temperature is a wee bit higher than before. Next, please. You can see, and here's danger level or higher, and so now we're at very high temperatures. And you can see that there's still problems in the southwestern United States and in the whole eastern part of the country, right? And so not everybody's going to have the same lived experience in all kinds of ways in different parts. And so this intersection, population, health and place, is about trying to leverage our knowledge and understanding and data to make sense of the world and to plot better futures. Next, please. It's a vibrant program. 2 of the 6 people shown here are present with us today. 1 and 2 over there. And you can see the point here is that there's a wide range of interests accommodated in this program, and these young men and women get to pursue topics that are important but quite different from one another. Next. So far, I think we have 17 graduates. 8 are currently postdoctoral fellows, 2 work for the federal government, 3 are tenure-track professors, 1's a non-tenure-track professor, 1 works in the geospatial and health industry, and there's 2 perhaps we don't know about or that have been changing jobs recently. I would say as well that the average time it takes to complete this program is 5 years. 2 people have taken 6 years, and 2 people had job opportunities that saw them finish a year early. So they only took 4 years. Next, please. And I'll just show you 3, and then we'll switch to questions. This is Avery Eberhardt. She graduated in 2022. Her dissertation topic was incomplete data and insufficient methods, transgender population health research in the US, and she's now an assistant professor of GIS, cartography and transformation in the Department of Geography at the University of British Columbia. Next. Ying Lin. This is a young lady that finished a year early to take a job with the Gates Foundation. Her dissertation topic, child wellbeing and changing families in evolving contexts, a multi-country analysis of child health and disparities. And she's just taken a position this semester as Assistant Professor of Global Health Policy at the University of Texas at Dallas. And last, next, Michelle Livings, Ph.D. in 2023, the influence of interpersonal, organisational, community and societal contexts on youth mental health. She used a cohort that's been managed and collected at Princeton University. Immediately after graduation, she was a postdoc with that cohort study in Princeton. And she's just this semester taken a job as Assistant Professor of Health Sciences at Rutgers University at their Camden campus. All 3 of these individuals did something before they went to their current jobs. Avery was a postdoc at the University of Michigan, not for very long. Ying Yi was a research fellow at the Gates Foundation, turns out not for very long. And Michelle Livings was a postdoc in Princeton for, I think, a little over a year, right? And typically these people have been in high demand, and almost all the postdocs, from my vantage point, have taken positions at aspirational universities. UC San Diego, UC San Francisco, Michigan, Harvard, Princeton. These are all schools that in some ways are better and better ranked than USC. Next. So we have some time. We can go over a few minutes, think, for any questions that what you might have. And you could ask me the questions or ask other people in the room or even the students. Yes, ma'am. We'll start with you.
Good evening, I'm Dawn Russell, and I am very excited to be applying for this program, especially because of the interdisciplinary approach. What would you say are the skills that the students acquire that enable them to make an impact in their community? Obviously, they go on to do some prestigious postdoc work and work at institutions. But what is the unique skills that students have in PhD that enable them to be, as you mentioned, world changers?
Okay. Do you want to take it to Daniel first?
I mean, that's a tough question, and there are probably a lot of them. I think what I like to highlight is what was talked about in terms of the advising structure, in addition to all of the coursework and so forth. Part of the experience is having not just co-advisors, but also a committee and then an open community of scholars who have different perspectives, who are bringing different disciplinary traditions, different analytic frameworks. And so oftentimes it both creates a structure that ensures one has to be, or at least from my perspective, the students can speak better about what it's like to go through it, but it ensures that one is thinking more broadly than oftentimes like a single home discipline is in tackling complex problems. It also offers an ability to collaborate with a discipline that maybe even has, let's say an analytic approach that's not as common in the sort of home discipline of a co-advisor. And I think there's something about the structure and then the structure of being with interdisciplinary scholars that helps foster an ability to tackle challenging problems in a different way.
Thank you. That was a good answer. There's something about probably the structure that I forgot to tell everybody, and that is that I have this vision. I currently work with 5 students, so I'm co-advisor for 5 students. One is Andrew over here, and my philosophy is that a PhD is like going on a road trip with somebody. And the PhD student in my mind is the driver, and I'm the person sitting in the passenger seat. So imagine some family trip you took once with your mother and father and they weren't very happy with each other. Maybe the passenger was not giving directions often enough, and so you took a detour that was 300 miles the wrong way and somebody had to be blamed for that. Or the alternative was somebody was yapping every moment, telling them, slow down, go faster, turn left, stay in this lane, get in the other lane. Person's talking too much. Again, disaster. Mum and dad aren't talking to each other and you're the kid sitting in the back of the car, right? So my idea is that PhD is the driver. I'm the co-advisor, so I'm the sidekick, right? I'm very interested in their success, but part of the thing here is that they're going to leave ready to lead themselves, and so they need to practice doing that. Now, to help facilitate that, when you submit an application, you can tell us who you want to work with, but I'm going to tell the admissions committee to ignore that, because you're not going to, if you got an offer letter from us, it's not going to say who your 2 co-advisors are. You're going to have 1 year, 12 months, or a little bit more, to choose your 2 co-advisors. Now, to be fair, there are faculty that feel very uncomfortable in this framework. What do you mean they're going to be checking me out? Why can't I just have somebody designated to me? Well, I don't think that's a good use of your time and energy, meaning the faculty member's time and energy or the PhD student's time and energy, right? And now not many programs do this, but we are intent on helping you be exposed to and maybe learn and use a really diverse set of tools and conceptual designs and so forth. And we want you to become the best you can be as both a scholar and a leader, right? So maybe that's generalizing what actually you were saying, right? And I know there are students that applied that have told me they're uncomfortable that that's the arrangement. Well, can I not just have an advisor and then they can day one tell me what I should be working on? I don't think that's that's not a good value proposition probably for either person. There'll be times when that would work brilliantly, but more often than not, there'll be times when that could have been much better. Well, anybody online with questions? Can we tell?
Jesse, any hands, maybe raise hands online if you have a question.
Hi, professors. My name is Xiaopeng Liu. Nice to meet you. I'm very interested in joining this program, and I have a question. How many students in total that you are expecting to accept in this run?
Okay, good question. I don't know the exact answer yet, but I'm guessing the number will be 3. It could be. It won't be more than 5. So it could be 3. It could be as few as 3, and it could be as many as 5. And I can tell you, I think, with some confidence that we will be using what we call rolling admissions. And so we are about to endeavour to sometime in January conclude with the admissions committee who they would recommend that we make offers to, and then we're going to have a list. Typically, we've had a list every year where the admissions committee suggests that I make many more offers than I have funds to pay for. So that's obviously a problem. If we had that problem again, I'm going to start at the top of the list, make an offer, and if that person turns us down and it's before that April 15th date, then I can continue making offers until I have a class the size that we want. So I think the advice is that if you were to get an offer and you were of opinion that you'd like it, it might be prudent to accept it more swiftly than what's been the practice in the past, where everybody waits till the evening of April 15th across the whole country, and then we all sort out what can and can't do then, right? At the moment, there's about 20 or 21, 22 students in the program. So we're not trying to be the biggest program in the world. We're trying to be the best program at what we do in the world. Quality trumps quantity here.
So Yaneth Rodriguez has a hand raised.
Okay.
Yaneth, can you go ahead, take yourself off mute? Go ahead. Thank you.
Hi, everybody. I wanted to be there in person, but I'm sick and I didn't want to get others sick. My name is Yana, and I'm currently a staff here at USC. I work with Dr. Lourdes Baez-Conde-Campanati, and I've been really interested in this program for a while. But my question is, I know you mentioned that when we apply, you don't want to see maybe names of who the advisors will be, but can we select a certain area that we're interested in? So, for example, I've been doing work in the tobacco area, and so I would want to, incorporate some of that, those experiences, but obviously incorporating the spatial sciences and sociology portions of it in the program. So I'm wondering, is that something that we can do in the application? Is like select a topic area that we're interested in? Or is that not advised? If you can clarify that. And I do have another question, but I think I'll wait.
Yeah, I think, Yaneth, thank you for the question. I think, yes, you certainly can identify, more specifically the area you want to work in at the intersection of PHP. That's probably a very good idea in your applications. Again, you don't have to identify, a particular professor who you think represents that area who would be your advisor, because you'll have the time to sort that out after you get here. We're not looking to sort for advisors when we read applications. So if you think there's a research group at USC generally that is in that area or something like that, and you want to make an oblique reference to that sort of group, you can, but the more important thing is to articulate your own vision of what you're gonna do with your PhD.
Baba, I'm gonna jump in here and also add on to that. I included in the chat for you, Janet. But basically, we do still take that information, so please feel free to include it in your application. We do have that in the application instructions. So yes, to answer your question, please include it.
Thank you, Jack. And then Matthew Zanika had a hand raised.
Hi, I just had a quick question regarding the Institute of Global Health. I'm pretty interested in doing healthcare delivery systems within Mexico and specifically with Los Angeles as well. Obviously, it's a very large Mexican populations. And I was curious if there are opportunities to go abroad or if there's opportunities to work with the Institute of Global Health to then go to Mexico, or like what does that look like essentially if we were to do this PhD program?
I think it's all case specific, and given what you just described about your case, something like that should be doable, right? And there are many institutes at USC, including the Institute for Global Health, that would touch on a topic like you just described, or the interest you had in the two parts of a population that you were interested in. So, my job is to help find the resources so that students can be the best they can be. And in order to do that, sometimes that takes some additional resources for travel and field work and things like that. And there are ways to find money like that across the university. But it's decided. It's all then dependent on your research and your research goals and what one needs to do to execute and leverage those goals. But we have several students that have worked overseas.
Yeah.
Yep. So it's not uncommon.
And just trying from memory kind of say this, but in our PHP faculty, as it exists now, there's at least 3 faculty that come from the Institutes on Inequalities and Global Health at USC.
Yes.
So we definitely have the connections over there, and we've had students work in that area. So certainly welcome that.
Awesome. Thank you.
Any other questions? Follow-ups? Okay. All right. So.
Okay, so
One more thing I wanted to mention, I included in the chat for those that are joining online. The application is currently open, so you guys can go ahead and start your application and start applying in the application portal. Application deadline is December 1st.
Maybe it's worth taking just 1 minute to say, so the gentleman who's just talking to you via the Zoom is Dayron Caro, who's our dynamic staff member here at Spatial Science Institute, and he's helping to handle the logistics of all the applications. So if you confront something like, getting a test score over to us or getting transcripts to us or something like that, he's a great point of contact for you. And I'm the director of graduate studies, and so questions about how you structure your application, more questions about the program, what's in the program, things like that occur to you, certainly send me an email. And we can follow up if there's more questions that occur to you after the session today. So the two of us are here in your court, and we'd love to see an application from everyone. And so who's joined us today, and anyone who's listening to the recording online. So if you have questions about that, please direct those towards us.
thank you. Okay, I'd like to thank everybody for their attention for the last hour and a bit, and wish you the best for the rest of the day, the rest of the week, the rest of the year, and we would love to see an application from each and every one of you. Thank you.